Hello, this is Neil Baum from New Orleans, Louisiana, and I'd like to take about 7 or 8 minutes to talk with you about some suggestions for enhancing your communication with your colleagues. In the past, I have used this slide to talk about 4 pillars of a successful practice. Today, I would like to talk about your relationship with your colleagues. Communicating with your colleagues is one of the most important aspects of your practice. It doesn't matter if you are in primary care or if you are a specialist, communication is key to good patient care. Let me start by telling you or suggesting to you what not to do regarding communication with colleagues. Here is an example of a referral to a general surgeon, and he sent me this note which says, "Please see copy of the office notes." And you can see from the office notes, it is hardly legible. And I would suggest that this is not an effective referral letter. Here's another example of what not to do. It is a note to a referring physician, and the patient was sent to this physician asking for a consultation. And the only comment that was given was, "Thanks for sending the patient over." Again, not an example of good communication with a colleague. In order to communicate effectively with a colleague, you want to see that your name crosses the mind and the desk of that colleague and his or her staff as frequently as possible. Why do physicians refer to other physicians? The second most common reason after having the patient return back promptly is that the physician who receives the patient reports back promptly. This is very, very important in terms of enhancing communication with your fellow colleagues. The traditional referral letter that most physicians use is far too long. It arrives 10 to 14 days if you use the postal system. It's very expensive. It's $15 to $20 to dictate a letter, including your time and the cost of a transcriptionist and the stationery and the postage. So it can be very expensive. Sending a completed note from an electronic medical record is not an effective way to communicate, because that physician who receives this letter is as busy as you are and does not have the time to read the letter. And a effective referral letter contains just 3 ingredients. It's the diagnosis, the medications that you have added to the patient's clinical condition, and the treatment plan that you are recommending. The goal of an effective letter is that that letter arrives on the desk of that referring physician before the patient returns to that referring physician. So here's an example. Jane Doe was referred by Dr. Bill Smith. Patient had a diagnosis of stress incontinence. The finding on the physical exam was a cystocele. The urinalysis was negative. You recommended an anticholinergic medication, and probably we're going to proceed with a mid-urethral resling and an anterior repair. You have a computerized referral letter that allows you to fill in, or your medical assistant or nurse, at the end of the day, the name of the doctor, patient name, diagnosis, medications that you prescribe, and your plan of action. So this is how that letter might look. Dear Bill, Jane Doe was seen for a problem of stress incontinence. I recommended this medication. I plan to obtain a urodynamic study and cystoscopy, and I will ask you for surgical clearance for a mid-urethral sling and anterior repair. If you decide to use an electronic medical record referral letter, you can create a template on your referral letter. You can a referral letter that will glean from this electronic medical record the diagnosis, the medications, and the treatment plan. And so all that has to happen is that the blanks have to be auto-filled in, and most electronic medical records have the capacity to create this kind of a referral letter that lists the patient's name, the diagnosis, the medication, and the new treatment plan, and the diagnosis, including the CPT code. If you don't have a computer, you can use a pre-printed form, and again, fill in the blanks where you send the letter with the patient's name, diagnosis, mention the medications, and your treatment plan. And if you would like to see that that letter gets back to that referring physician before the patient arrives, you can fax it that afternoon, so you can almost be certain that the letter arrives before the patient returns or calls that referring physician. Then there is the modified traditional referral letter, where you can, at the beginning, at the very top, include the 3 ingredients that I mentioned: diagnosis, physical findings, and recommendations. And then you can have a longer letter. If the doctor doesn't have time to read the longer letter, at least the doctor can read the 3 necessary ingredients right at the top. Suppose you are a primary care doctor and you're requesting a referral from a specialist. You can send the specialist the patient's name and information, insurance information, your request for a referral, how soon you would like the patient to be seen, and how you want to receive the report. This makes you and your practice very user-friendly if you send this information to that referring doctor and letting him or her know exactly what the problem is and how you want to receive that report. Another example is if you're going to modify a patient's medication that was ordered by another doctor. For example, if you are going to perform a prostate biopsy and the patient's on aspirin, you would like to discontinue the aspirin for a few days before the procedure, you probably ought not to do that without checking with that primary care physician or that internist. Making it user-friendly, you can include at the bottom 2 options. Yes, you can discontinue the medication, or no, do not discontinue the medication. That doctor can check the appropriate box, return it to you by fax or mail, and now again, you have become very user-friendly. So what's the bottom line? Given the considerable issues and problems of maintaining continuity regarding patient care, the greatest importance in developing a good collegial relationship with referring doctors remains good communication. Well, I hope you found this brief video on communicating with your colleagues helpful and useful. If you would like a copy of my book chapter on physician referrals, you can reach me at the email address shown on this last slide. Thank you.